All right, so today we're taking a deep dive into EHR implementation from the perspective of a business analyst.
Definitely a hot topic.
It is. And picture this. We've got a busy outpatient department in a hospital, and they're transitioning to a new system.
Sounds like a recipe for chaos.
It could be, but we're going to break down that process step by step using a real-world example of transitioning to Epic Ambulatory.
That's a big one.
It is a popular system, and so if you are a business analyst or a healthcare IT professional, this is for you, because we're going to give you a clear understanding of the key steps involved in this kind of project.
We'll cover potential challenges, too.
Exactly. And even look at some industry standards like HL7 FHIR. Let's get started.
All right, so first things first, we need to figure out who this new EHR is going to impact.
Okay, so we need to identify our stakeholders.
Precisely.
Okay, that makes sense. Teamwork. But who are we talking about here? Who are the key players in this scenario?
Well, in a hospital setting, you've got a pretty diverse group.
More than just doctors, I'm guessing.
Oh, yeah. You've got your clinicians, of course. So that's your doctors, your nurses, your physician assistants, anyone directly involved in patient care.
Okay, makes sense.
Then you've got the medical coders and billers. So they're handling all the financial aspects, making sure the hospital gets reimbursed for services.
The money, folks.
Exactly. And then you can't forget about compliance and privacy officers making sure everything is legally sound and that patient data is protected. And then last but not least, you've got the IT team, the ones who will actually be building and implementing the system.
Right, the tech wizards behind the curtain.
Exactly.
Okay, so that's quite the team. I can only imagine the scheduling nightmares just to get everyone in the same room.
It can be a challenge.
But why is it so important to get all of these different people involved right from the start?
Well, because each of these groups has different needs and priorities when it comes to the EHR.
Okay, that makes sense.
For example, clinicians, they need a system that's user-friendly and efficient. You know, they don't want to spend all day wrestling with technology.
They need to focus on their patients.
Exactly. Billers, on the other hand, they need accurate and complete data to ensure proper billing and reimbursement.
Right, so they're not chasing down missing information.
Exactly. And then compliance officers, they need to ensure that the system adheres to all the relevant regulations and safeguards patient privacy.
HIPAA.
Exactly. So if you don't get everyone's input up front, you risk ending up with a system that doesn't really work for anyone.
And that defeats the purpose.
Exactly. It can actually create more problems than it solves.
So it's like designing a kitchen without talking to the people who are actually going to be using it.
Exactly.
You might end up with a beautiful island, but no counter space to actually prep food.
I've seen that happen.
So how do you go about gathering all that input from all these different people?
Well, there are a few key strategies. The first one is conducting interviews. So sitting down with representatives from each stakeholder group and really digging into their current workflows, their pain points, you know, what they hope to see in a new system.
Okay, so really getting into the nitty-gritty.
Exactly. And then the second strategy is observing current practices. So actually shadowing clinicians, billers, and other staff members and seeing how they interact with the current EHR.
So kind of like being a fly on the wall.
Exactly. It's all about understanding the day-to-day realities of each group. That's how you uncover those specific needs that the new system has to address.
Okay, so you've talked to everyone, you've shadowed them, you've got a mountain of information. What do you do with it all?
Well, this is where the core of your role as a business analyst comes in gathering functional requirements.
All right, so we're taking all of that feedback and we're turning it into actionable items.
Exactly. We're translating those stakeholder needs into actual solutions within Epic Ambulatory.
Okay, so let's say we're sitting down with a group of clinicians. What are some common EHR challenges that might bring up?
I'm sure you can imagine, but some common themes are going to emerge.
Yeah, I bet.
One big one is lack of templates for common conditions.
Oh, yeah. I can see that being a problem.
Yeah, clinicians end up typing the same notes over and over again.
Huge time suck.
Exactly. So they'd love to have pre-populated templates for things like diabetes or hypertension.
Makes sense, streamline documentation and ensures consistency.
Exactly. What else?
What else? What other complaints are we hearing?
Another common request is voice-to-text functionality.
Oh, yeah. Dictation can be a lifesaver.
Absolutely, especially for clinicians who are constantly on the go or have a heavy patient load.
So a good voice-to-text feature would be a huge time saver.
Huge time saver. And then we also hear a lot about the need for structured data entry.
Okay, so how's that different from just regular data entry?
Well, with structured data, the information is captured in a standardized format, so it makes it easier to analyze and share.
Ah, so it's all about making the data work for you.
Exactly, and it's also essential for accurate billing and reporting.
Okay, that makes sense. And any other common complaints?
Finally, a lot of clinicians express frustration with finding past patient information.
Yeah, I can see that being a pain.
They need a system that allows them to quickly and easily locate previous notes, lab results, imaging studies.
So easy access to all the important stuff.
Exactly.
Okay, so you've collected this laundry list of complaints now. What, how do you take that and turn it into solutions?
Well, this is where meticulous documentation is critical.
Okay, so write it all down.
Exactly. We need to capture each of those functional requirements in a clear, structured format.
So everyone's on the same page.
Exactly. And it provides a roadmap for the development team.
Okay, so for example, let's say clinicians identified a need for smart phrases to streamline their documentation.
Okay, good example.
How would that be documented?
Well, that would become requirement ID, FR01, in our documentation.
Okay, so each requirement gets its own unique ID. What else is included? Is it just a list of complaints?
No, we need to go deeper than that. We need to clearly define the requirement, its priority level, and a justification for why it's important.
Okay, so it's not just what they want, but why they want it.
Exactly. So for FR01, the description might be, clinicians need access to smart phrases and smart texts within Epic Ambulatory for common conditions, medications, and procedures.
Okay, so spelling it out very clearly.
Exactly. And then we assign a priority level so you know how critical this feature is.
So in this case, I imagine it'd be pretty high priority?
It would probably be high because it directly impacts clinician efficiency and patient care.
Makes sense.
And finally, we provide a justification.
Oh, the why.
Exactly. So this might state that smart phrases save clinician time, reduce documentation errors, and improve the consistency and quality of patient records.
So you're making the case for why this requirement matters.
Exactly.
So basically, you're creating a blueprint for the developers, telling them exactly what needs to be built, how important it is, and why.
Precisely. And remember, this is just one example. We need to document each requirement with the same level of detail.
Oh, wow. So that's a lot of documentation.
It is, but it's crucial, and that
Wow.
includes things like voice-to-text functionality, data search capabilities, and even specific IPA safeguards.
Okay, so there's a lot to keep track of. Can you give me a sneak peek at some other interesting requirements that might come up?
Sure, so let's take FR02 addressing that voice-to-text functionality. It might specify that the system should seamlessly integrate with a reliable voice recognition software, allowing for dictation directly into patient charts.
Okay, very cool. And what about that data retrieval issue?
Yeah, so maybe FR04 that might focus on data retrieval, and it could specify that clinicians should be able to access a comprehensive patient summary, including past medical history medications, allergies, recent lab results within 3 clicks.
Wow, 3 clicks. That's impressive.
The idea is to make that information really easily accessible.
Okay, so it's all about making the clinicians' lives easier so they can focus on patient care. Well, it sounds like we've just scratched the surface here. I imagine there's a lot more to this whole EHR implementation process.
Well, there's definitely more to come. But we've spent a lot of time talking about, gathering those requirements, documenting them, really getting into the weeds of what our stakeholders need.
We really built a solid foundation.
We did, and now it's time to kind of zoom out and look at how those requirements fit into a larger context.
Okay, so we've got our list, our blueprint for our new Epic ambulatory system.
Yeah.
What's next?
Well, now we need to think about how this system is going to interact with the rest of the healthcare world.
So it's not an island.
Exactly. It's all about interoperability.
Interoperability.
Yeah.
That sounds very technical.
It can be, but think of it this way. A hospital doesn't exist in isolation. It's constantly exchanging information with labs, pharmacies, insurance companies, other healthcare providers.
Yeah, lots of moving parts.
Exactly. And for everything to run smoothly, those systems need to be able to talk to each other.
They got to be on speaking terms.
Exactly. They
Yeah.
need to be able to share data seamlessly. That's what interoperability is all about.
Ah, okay, so it's like making sure everyone's speaking the same language.
Exactly. And in the world of healthcare IT, that language is often HL7 FHIR.
FHIR.
What is that?
It stands for Fast Healthcare Interoperability Resources.
FHIR. Okay, got it. But how does that actually work in practice?
Well, FHIR provides a standardized way to exchange healthcare data. Think back to our requirement for structured data.
Right.
With FHIR, we can define specific data elements like a patient's condition, an observation like a lab result, or an encounter like a doctor's appointment.
Okay.
And these are called FHIR resources.
Resources. Okay. And by using these standardized resources, different systems can understand and share information easily.
Ah, so if a patient gets a blood test in an external lab, the results can be automatically sent to their EHR in the hospital thanks to FHIR.
That's the idea. It streamlines communication, reduces errors, and makes sure that everyone has the most up-to-date information.
That's great. Less room for mistakes.
Exactly. And of course, we can't talk about healthcare IT without talking about security and compliance.
Right, APR, always top of mind.
Absolutely. Especially when we're talking about a system that houses sensitive patient data. Our EHR needs to be built with security as a top priority.
So what does that look like in practical terms?
Well, one key aspect is role-based access control. So different users have different levels of access to the system and patient data depending on their role.
Okay, that makes sense.
So a doctor might have full access to a patient's chart, but a billing clerk might only be able to see information that's relevant to billing.
So kind of a system of checks and balances to make sure only authorized personnel can access certain types of information.
Exactly. It's all about protecting patient privacy and preventing unauthorized access or modifications.
And imagine that includes things like audit trails to track who's doing what in the system.
Absolutely. Strong password requirements, encryption to protect data, both when it's being transmitted and when it's stored.
So many layers of protection.
Yeah, we're talking about highly confidential medical records here. You can't be too careful.
No, you can't.
Mm.
What else do we need to think about from a compliance perspective?
We also need to think about medical coding.
Oh, right, the ICD-10 and CPT codes.
Exactly. Those are essential for billing and reimbursement. So our new EHR needs to support coders in assigning the correct codes based on patient documentation.
So it's not just about capturing the information, it's about making sure that that information can be used for accurate billing and reporting downstream. So we've gathered requirements, we factored in interoperability with HL7, FHIR, we've addressed HIPAA compliance, we've got a pretty solid plan on paper. But what happens when we take it back to our stakeholders? Do they always love what we come up with?
That's a great question, and it brings us to a crucial step: validation.
Validation, so kind of like a reality check.
Exactly. We've been in our business analyst bubble. Now we need to bring it back to the real world and make sure that the solutions we've designed actually meet the needs of the people who will be using the system.
Yeah, I can imagine that could be a little nerve-wracking. You spend all this time crafting the perfect plan, and then someone comes in and says, wait, this isn't what I had in mind.
It definitely happens. That's why it's so important to approach validation as a collaborative process. We need to be open to feedback, even if it means making changes to our original plan.
So how do you manage that process? How do you present, sometimes complex technical requirements in a way that makes sense to everyone?
Well, visual aids can be really helpful. Mock-ups or wireframes can give stakeholders a tangible representation of how the new system will look and function.
Show them what it actually looks like.
Exactly. It's much easier to understand a concept when you can see it in action.
Right. It's like showing a client a 3D rendering of their new kitchen instead of just handing them a blueprint. It helps them visualize the final product.
Exactly. And during these validation sessions, it's not uncommon for new requests or ideas to pop up.
Uh-oh, scope creep.
Exactly.
That doesn't sound good.
It can be if it's not managed properly.
Okay.
Let's say, for example, that during a validation session, a physician requests an AI-based transcription feature. It wasn't part of the original plan, but they see it as a valuable addition.
So how do you handle that without derailing the entire project?
Well, the key is to have a structured process for managing change.
Okay.
So first, we document the new request in what's called a change request log.
Change request log. All right.
And then we assess its feasibility with the IT team. Can it actually be implemented? So what's the effort involved?
And finally, we need to have an honest conversation with leadership about whether this new request fits into the project timeline and the budget.
So it's about balancing flexibility with the need to stay on track.
Exactly. We need to be able to accommodate new ideas and requests, but we also need to be mindful of the project's constraints. It's a delicate dance.
It sounds like it. All right, so we've gathered requirements, we've validated them, and even managed to tame the beast of scope creep. Feeling pretty accomplished right now, but I have a feeling there's still more to come.
There is. We've laid the groundwork, but now we need to shift our focus to the actual development and implementation of the system.
Okay, so we're moving from the planning phase to the let's make this happen phase.
Exactly.
What does that entail?
Well, first we need to make sure that all of our meticulously documented requirements are translated into clear technical specifications for the IT team.
So we're handing off the baton.
Exactly. We've created the recipe. Now it's up to the chefs to cook the meal.
Okay, but our job doesn't end there.
Yeah.
Absolutely not. We also need to be involved in developing test cases to ensure that the system works as intended.
Test cases, what are those?
Think of them as scenarios that mimic real-world use of the system.
Okay.
We need to make sure that everything from entering patient data to generating reports to accessing specific information works smoothly and accurately.
So kind of like a final quality control check to make sure that everything meets the specs and functions as expected.
Precisely, we want to catch any bugs or glitches before the system goes live and real patients are involved.
Yeah, you definitely don't want to launch a brand new EHR and then realize it can't handle basic tasks or generate accurate reports. What kind of things are you testing?
We test everything. We test the functionality of SmartPhrases, making sure they can be inserted properly and that the text expands correctly.
Oh, yeah.
We test the search functionality, verifying that clinicians can find past patient notes within those specified 3 clicks.
Right.
We even test security features, making sure that unauthorized users can't access sensitive data.
So you're trying to anticipate every possible way a user might interact with the system and make sure that it can handle it gracefully.
Exactly. And remember, those test cases need to be clearly documented and executed in a systematic way. This is an essential step in ensuring a smooth and successful EHR implementation.
Thorough planning, testing, documentation. It sounds like we've really covered a lot of ground here, from gathering requirements, navigating interoperability, to ensuring compliance, and even managing change requests. We've explored a lot of facets of this process.
We have, but there are still a few more key elements to cover, including change management, data migration, and the ongoing maintenance and support of the system.
So we've talked about stakeholder interviews, gathering those requirements, mapping out those requirements and validating them with our stakeholders. And then we tackled those, big things like scope creep and testing the system thoroughly, but we're not quite done yet, right?
Not quite. We've built the system, but now we actually have to figure out how to get people to use it.
Right. You can't just expect everyone to magically know how to use this new EHR.
Exactly. And that's where change management comes in.
Change management, what is that?
It's all about preparing our stakeholders for this transition, addressing any concerns or anxieties they might have.
Okay, so hand-holding, basically.
In a way, we need to provide the training and support they need to feel confident using this new system.
So it's not just about building a great system. It's about making sure that people actually know how to use it and are comfortable with the change.
Precisely. And that involves a multifaceted approach.
Okay.
So first and foremost, communication is key. We need to keep our stakeholders informed throughout the entire process, not just at the end.
So regular updates, emails, meetings, that kind of thing.
Exactly.
Thank you.
We explain the benefits of the new system, we address their concerns, and we're transparent about any challenges or potential disruptions.
So no surprises.
Exactly. And then, of course, there's training.
Training. Okay, so what does that look like?
Well, training should be tailored to each stakeholder group's specific needs and roles.
Okay, that makes sense.
So clinicians, for example, they might need hands-on training to learn how to navigate the new system, document patient encounters, and access patient information.
Okay.
But billers, on the other hand, they might need more focused training on using the system for coding and billing functions.
Right, so everyone gets what they need.
Exactly. And we also can't forget about ongoing support.
Ongoing support. So even after the go-live date?
Absolutely. Even after the initial training, people are going to have questions, encounter challenges, or need a refresher on certain features.
So it's like providing ongoing customer service for your users.
Exactly. They need to know that they have a lifeline if they run into any issues.
And that could involve like a dedicated help desk or online tutorials, even peer-to-peer support groups.
Oh, great example.
Okay, so we've got our new system up and running. Everyone's trained. We've got support in place. What's next?
Now we need to talk about data migration.
Data migration. What is that?
So we're transitioning from an old system to Epic Ambulatory, right?
Right.
All of that existing patient data needs to be transferred to the new system.
Oh, wow. I bet that's a huge undertaking.
It can be a very complex and delicate process.
We're talking about, sensitive patient data, medical records, lab results, billing information. You can't just hit copy and paste and hope for the best.
You're telling me we need to make sure that everything is transferred correctly and securely.
No room for error here.
Exactly. It's a meticulous process that requires careful planning and execution to ensure data integrity and accuracy.
So walk me through it. What are the steps involved?
Well, first, we need to map out the data fields between the old system and the new system, making sure that everything is transferred to the right place in Epic.
So it's like moving from one house to another. You need to pack everything carefully and label it clearly so it ends up in the right room in the new house.
That's a great analogy. And just like when you unpack boxes in your new home, we need to validate the migrated data to make sure that it's complete, accurate, and consistent with the original data set.
Makes sense. So what are some of the things that can go wrong during this whole data migration process?
Well, one common challenge is dealing with data that's, inconsistent or even inaccurate in the old system.
Oh yeah, dirty data.
Exactly. So we need to establish clear procedures for cleaning and standardizing this data before it's migrated to Epic.
So it's like cleaning out your closet before you move. You get rid of anything that's outdated, damaged, or doesn't fit anymore.
Precisely. And another challenge is ensuring that the data migration process doesn't disrupt ongoing operations.
Right, so you can't just shut down the entire hospital while you're moving data around.
Exactly. We need to carefully plan the timing and execution to minimize any downtime or impact on patient care.
So it's a balancing act. You need to get the data into the new system, but you can't bring everything to a halt while you're doing it.
Right. And even after the data is migrated, we need to think about the ongoing management and governance of this data.
So it's not just about moving the data, it's about taking care of it once it's settled into its new home.
Exactly. We need to establish clear policies and procedures for data access, security, privacy, and retention.
Okay, so making sure that the data is used responsibly and ethically.
Precisely. Always in compliance with HIPAA and other relevant regulations.
So it's like creating a constitution for your data, establishing the rules and guidelines for how it's governed and protected.
That's a great way to put it. And just like a constitution, this data governance framework needs to be adaptable and responsive to the evolving needs of the organization and, the ever-changing landscape of healthcare regulations.
Right, always staying up to date. Well, I think we've covered just about everything, hasn't we?
We've really gone through a comprehensive overview of an EHR implementation project.
From stakeholder engagement and change management to the complexities of data migration, it's clear that this is not a simple undertaking.
It's a multifaceted process for sure.
But it's an important one.
Absolutely. By carefully planning, thoughtfully executing, and continuously adapting, we can leverage technology to really make a difference in healthcare.
It's all about improving patient care, ultimately.
Exactly.
For those who want to learn more, we have a curated list of resources and articles in the show notes.
Be sure to check those out.
And as always, thanks for listening.
Until next time.